Hi friends, good evening. Once again, welcome back to my channel Mookambika Nursing. Here in this section of videos, we can see the questions from pediatric nursing, and this will be important. This is an important question and will help for your future exam. We can see the question one by one. The first question: what is the most common complication for which a nurse must monitor preterm infants? And the options are: option A, brain damage; option B, feeding problem; option C, respiratory distress; option D, hemorrhage. Here question is: which is the most common complication that can occur for a preterm infant? And the correct answer is option C, a respiratory distress is the correct answer. Here the preterm infant, they have immature lungs and also they have immature immune system. So there is a chance of or common complication can occur for this preterm infant is respiratory distress. And the next question, second question: squatting position is preferred for a child with tetralogy of Fallot because options are: option A, increase pulmonary blood flow; option B, prevent irreversible right ventricular compression; option C, prevent irreversible crying of a child; and option D, none of this. Here the correct answer is option A, increased pulmonary blood flow. Squatting position is the preferred position which is given for a child or for a patient with tetralogy of Fallot. That will increase the pulmonary blood flow and will prevent the cyanosis. Okay, this tetralogy of Fallot is a cardiac abnormality which include 4 defects. That's all: ventricular septal defect, overriding of aorta, pulmonary stenosis, and right ventricular hypertrophy. Third question: which method should a nurse choose to assess the arterial oxygen saturation of a pediatric client? And options are: option A, hemoglobin level; option B, finger pulse oximetry; option C, arterial blood gas analysis; and option D, all of these. Here correct answer is option B, finger pulse oximetry is the common method which is used to assess the oxygen saturation for pediatric client. This finger pulse oximetry is a non-invasive method which is used to assess the oxygen saturation. If it is not accurate or if it is not getting, then we can go for arterial blood gas analysis. Here correct answer is option B, finger pulse oximetry. Question number 4. A child receives a blood transfusion. What should the nurse do first if an allergic reaction to the child occurs? And options are: option A, stop the infusion; option B, slow down the infusion; option C, inform to the doctor; option D, watch and wait. And here correct answer is option A, stop the infusion. Any patient, if it is child or if it is adult patient, if there is an allergic reaction occurs during the time of blood transfusion, we should not wait or we should not watch, we should stop the infusion first. Then we have to do next step, that is inform the doctor, we have to do BP, we have to check vital signs and all. First we have to stop the infusion. Option A is the correct answer. Question number 5. A nurse is administering medication to a pediatric child with hypertension. Which one of the following medications is not given for this child? And options are: option A, calcium channel blockers; option B, ACE inhibitors; option C, nitrate; option D, diuretics. And the correct answer is option C, nitrates. These nitrates are vasodilators. They are mainly given for the treatment of angina. Here the patient or the child is hypertensive, so he can take calcium channel blockers or ACE inhibitors and diuretics, but nitrates are not given for a patient or for a child with hypertension. When an object is kept in the palm of a neonate, he grabs it with closed fingers is called: option A, rooting reflex; option B, palmar grasp; option C is turtle reflex; option D, none of this. And here the correct answer is option B, palmar grasps is the correct answer. So when an object is kept in the palm of a neonate, the neonate start to grabs it with fingers. Okay, this is called a palmar grasp reflex. Here option B is the correct answer. This reflex section is very important area. Thoroughly you have to read once the all reflexes. Question number 7. Stomach volume of a child estimated to be. And the options are option A 2% of child body weight, option B 1% of child body weight, option C 3% of child body weight, and option D 4% of child body weight. Here the correct answer is option C 3% of child's body weight. Question number 8. Which vitamin is helpful in promoting intestinal absorption of calcium and phosphorus? And option A vitamin A, option B vitamin C, option C vitamin D, and option D vitamin B1. Here the correct answer is vitamin D, which helpful for promoting intestinal absorption of calcium and phosphorus. Question number 9. Commonly used therapy for the treatment of thumb sucking is option A flooding, option B aversion therapy, option C myelotherapy, option D psychotic analysis. Here correct answer is option B aversion therapy is mainly used in case of or used in the treatment of thumb sucking. And the next question, 10th question, a baby start to run at the age of option A 9 months, option B 12 months, option C 15 months, option D 18 months. A baby start to run at the age of option D 18 months is the correct answer. Usually the baby start to run at the age of 18 to 24 months. Here 18 months is the option, so it is correct option D.